The contact tracing program that we've developed in partnership with the Butler County General Health District really highlights our public health program here at Miami. At Miami, we have a human disease and epidemiology track, a health policy and administration track, and a health promotion and education track. And as contact tracers, students got experience in all of that content area.
This was going to be a big project, and I understood that we were going to need a steady stream of people who could help to do contact tracing in this outbreak. We were provided with grant funds from the Ohio Department of Health, and I knew that I would have to hire a lot of people to help with this. It became apparent that we could figure out a way to do this in a win-win situation where students would benefit and the community would benefit. And so I spoke to the faculty members who could potentially be involved.
Global health is about improving health equity for people anywhere in the world. And this opportunity to participate and partner with the Butler County General Health Department on their contact tracing initiative really enabled our students to practice global health.
Our contact tracers made tens of thousands of phone calls to community residents. We also conducted thousands of interviews in order to successfully isolate and quarantine members of the community to help slow the spread of the disease during the pandemic.
We have been so fortunate to have over 130 students working with us on this project.
This pandemic has been really hard on everybody, and contact tracing has been something that has helped keep our community safe and help mitigate the spread of COVID.
Being efficient in that sense has been great. We can get to more people more quickly. We also can protect the community better, reaching more people every day.
I was like, wow, this is my field. So I got in there and also try as much as possible how to put people into isolation and quarantine to reduce the spread of disease.
It's just taught me how to be more compassionate and taught me how to, talk to people when it comes to sharing health, because health is a very, very intimate topic to discuss with people that you don't even know.
With the help of the project investigators, we were able to work in real time on a virtual program and to communicate with each other. It actually worked surprisingly well in the end, so I'm happy that we had such good leadership.
I was on the phone with this older man. He had tested positive, so he had been isolating away from his wife. And they'd been together for, I think he told me 30 plus years. I got to be the one to tell him that he could go starting at 12:01 a.m. the following day, because he was cleared for release, he could go and see his wife again. And he started crying with me on the phone, and it was just a really humbling experience to get to share that moment with him, because he was being very emotionally vulnerable.
It was just very nice to see how the work I was doing was actually making a difference, and not just for one person, but for everyone.
Seeing what contact tracing is and seeing why it's so important has really strengthened my love for public health and has really shown me how important it is for the community.
Every once in a while, there would be somebody who would take a second at the end of the call and be like, thank you for the work that you're doing. And it made it worth it, because it felt like, okay, I'm actually making a difference.